Good day, everyone. My name is Trust Digo once more. So, as promised, we'll be discussing a series of investigations that is needed for a pregnant woman to run before delivery. And today, I would like to discuss the ABO blood group, that's blood grouping test for a pregnant woman. Now, first of all, what is blood group? Blood group uh, can be classified into two. It's not as if it's classified into two. There are various classification of blood group, but I want to limit myself to the ones we normally carry out when we go to the laboratory. That's a common blood grouping system we carry out. There are two majorly. For example, if you heard somebody say I'm A positive, I'm B positive, I'm AB positive, and so on. That grouping of class, that blood grouping system, there are two tests in one. Now, when we say blood grouping system, the common one carried out in laboratory are two. One, the ABO blood grouping system of classification, and two, the resource factor blood grouping system. Now, what is the ABO blood grouping system? It classifies blood into four parts, which is the A, the B, the AB, and the O. And that's why you find out that today you can either be A, AB, B, or O. Now, that one for a pregnant woman is okay. That one does not count. Regardless of if you are blood group A, B, or AB, or O, you are okay during delivery. The other classification is very important for a pregnant woman, which is the resource D factor classification of blood group. Now, these blood groups, they are protein that are found in the surface of the red blood cells. So both the ABO and the resource factor, they are all proteins. So when they are similar in structure, we can classify them as their chemical composition is what differentiates them from each other. So the one that is A, it has a particular chemical composition that I would not like to go into because it's a video that everybody can understand, not just for medical personnel. Now, for the resource D factor classification of blood grouping, it classifies blood into two, which is those that have this resource D antigen present in the surface of their blood cells. For those that have resource D antigen present in their blood, they are classified as resource D positive individuals. While those that do not have resource D factor in their blood system, they are classified as resource D negative. So when you combine these two blood grouping systems together, that's why we can see people that are A positive, A negative, B negative, B positive, AB negative, AB positive, O positive, and O negative individuals. So for those that have the resource D factor present in their blood system, they don't have an issue during delivery. The focus is those that do not have the resource D factor present in their blood system, which are the ones we call the resource negative pregnant women. Why is it very important? Like we define not quite long, this resource factor is an antigen. The resource D present in the system is an antigen. And if the antigen is present, the body will produce a corresponding antibody that will bind and sometimes fight that particular antigen. Now, it is not present. Why is it very important for them to run this test? Because it may be possible that a pregnant woman that does not have this resource factor, that is resource negative, may be carrying a child that is resource D positive, meaning the person has the antigen. And if I don't want to go into that, in normal immunology, that's a normal discussion. If there's an antigen produced, an antigen is a foreign substance, can be a protein, being bacteria coming to the system. Now the system will produce an antibody. The antibody is like soldiers that will fight off that antigen in most cases. So now the mother does not have this antigen, but the child is carrying has this antigen. During delivery, there's a way it occurs that the blood of the child might likely mix with the blood of the mother, and the blood of the child that is positive, that has the antigen, may sensitize the blood of the mother to produce an antibody that will fight out that uh, antigen that is being produced. So what happens is that the child will be delivered very well, but in subsequent delivery, if the mother is pregnant for a positive child, the body has already created an antibody that will bind and fight that positive child. So you may see sometimes you see them having complications during delivery, some during pregnancy, some may have miscarriages, and some may even lead to what we call neonatic disease of the newborn and some other complications that may have during pregnancy. So that's why it is very important for us to carry out this investigation, so that if we are rhesus negative, there is a preventive measure for us to undergo during our antenatal before delivery, especially for those who normally deliver through this transmedical birth attendants. We're not saying they are wrong or they don't deliver very well. We are saying that majority of them don't carry out basic investigations. So even if you are going to use them, it is important that you visit a physician who will assess your care before your delivery time, so that all these investigations can be carried out and you can deliver your child and also deliver other children subsequent time safely without any hassle. And now, what happens for those that fall into this category? They are rhesus negative, or they are carrying a child that's rhesus positive. If we now find out from laboratory investigation that such a person exists, or maybe this person is pregnant and is rhesus positive, a rhesus negative, but is carrying a child that is rhesus negative, positive, what happens is that they are given an injection. The injection contains what we know as anti-D immunoglobulin. So what it does in the body is that it prevents the mother's body from producing the antibody that may fight subsequent children that are positive, that are rhesus positive, that the mother will give birth to. Meaning that if the mother should give birth to a child now that is a rhesus positive, in future time, if the mother is pregnant, the mother can also give birth to children that are positive without any complication. And how is it done? If, for example, the mother is rhesus negative and the child is rhesus positive, in developing countries like Nigeria and some African countries, the technology to carry out such tests has not been that prominent. Normally, there's a way they can collect the blood from the cord of the mother, and that blood will be tested in the lab to determine if the child's rhesus factor is negative or positive. Research has carried it out and said that the blood of the cord is accurate even after delivery. It can determine the blood group of the child accurately. But in developing countries like this, we have to wait until delivery. So what happens is that this injection is given to a pregnant woman that's rhesus negative, regardless of the rhesus factor of the child. So meaning, even if the child is positive or negative, the injection will be given before delivery. Then after delivery, within a time frame of 72 hours, the blood of the child is being examined in laboratory to determine if it's rhesus negative or rhesus positive. And if it is rhesus positive, that same injection is being given to the mother again to prevent future complications of other pregnancies. So if it is negative, meaning the mother does not have the antigen and the child does not have the antigen, so no antibody will be produced, no complication will result as a result of the fact that both the mother and the child lacks that antigen. So that is why it is very important. It may be a very common test in the laboratory, but it's very important to avoid complications. So it is very important for every pregnant woman, regardless of how you want to deliver, whether you want to use the maternity home, an hospital, or a TDA, it is very important for them to carry out this basic investigation. Thank you very much, and keep watching and stay tuned as we give more details about other tests that are also very important for every pregnant woman to carry. Thank you.